Why are cities important? And why should we care about getting city regions right? Watch the Urban Queue to know what it takes to shape a city that works for all. Hello, and welcome to yet another episode of the Urban Queue. Today I have with me Dr. Sudarshan Ballal. Dr. Sudarshan Ballal is a nephrologist, chairman Manipal Hospitals Group, and member of the board Manipal University. He is an adjunct professor of medicine at Manipal Academy of Higher Education, a clinical professor of medicine at St. Louis University Medical Center, and fellow of the Royal College of Physicians, London. He has been a part of many initiatives to improve access to good quality healthcare, especially for economically disadvantaged sections of the society. He is the recipient of numerous awards, has several publications, and is a Padma nominee. Welcome, Dr. Ballal. It is a pleasure and an honor to have you on our show, The Urban Q.
Thank you very much, Jaya. It's great meeting you after some time. We have had some wonderful interactions during the COVID pandemic. Fortunately, we recovered very well and bounced back from COVID, which we thought may not happen so early. And thank God for that.
Thank you, Dr. Ballal. So, Dr. Ballal, I'll start with this question. Now, you're a distinguished physician. You practiced in the US before choosing to return to India, and you've seen different sides to cities across continents and over time. So, what does a city represent to you, and which is your favorite city and why?
A city to me is the people who live in that city and people who represent the city and the experience of living in that city. In that sense, Bangalore is truly a cosmopolitan city that is multicultural, tolerant, and safe with good connectivity. We certainly could do better with cleanliness, traffic management, and less pollution, though. Now, you have put me in a little bit of a dilemma to choose the best city because it's difficult for me to make a choice between the city of my birth and childhood, which is Udupi, Mangalore in the erstwhile South Canara district, where I was born, grew up, and had my education and spent the first 30 years of my life, versus the city where I have settled, what used to be the Garden City, Bangalore, the city which I have spent most of my working life, professional life, which is again 30 years or plus. So I would rate them equally. Udupi, Mangalore, and Bangalore would be my choices if you ask me to settle down in any one place.
That is fantastic. It's different because you've chosen a tier one city and a tier two, three city. So that's very interesting that you think that all of these cities are good and that you like them all. So
You cannot shake your roots off.
that's true, absolutely. So no, thank you for that. Now, Doctor, as someone who meets a wide range of people from the city and on a daily basis almost, you have your ear to the ground in many ways. So, what would you say is the biggest challenge that beleaguers Indian cities today?
The biggest challenge that any city faces these days is the unplanned rapid growth, pollution, traffic wars, climate change, and unfortunately, the crumbling infrastructure. Beyond all of this, I believe the greatest problem of the society today is the cancer of corruption, which has spread all across. And unless we control that, we really cannot progress.
No, absolutely. And a lot of these problems, pollution, poor state of our environment, I think it's all a result of also the way that our cities are governed in many ways, and that's all symptomatic of it. But taking care of our health, for example, and since you come from the background of being a physician and you see a side of people where they are kind of impacted by the kind of urbanization, unplanned growth, congestion, and everything that is beleaguering us all. So, taking care of our health, whether we are talking about exercise, preventing disease, for our mental well-being, seems so deeply linked with our environment. So when you live in a tier one city versus in a tier two or three, that you can notice a distinct difference in sort of your health and well-being outcomes and the spaces we inhabit in general, indoors, outdoors, and for better or for worse. So, to what extent do you think city form and design might have an influence on our health outcomes?
The city you live in certainly has a great role in your health and well being. Pollution in the cities is a significant contributor to cancer, heart disease, respiratory diseases, and many other health issues. And it cannot be taken lightly. And all of us the citizens and the administrators need to work on reducing pollution. There are many ways which we can do this. Absence of clean drinking water, poor sewage management, accumulation of garbage and pools of water contribute to gastroenteritis, cholera, vector-borne diseases like dengue, chikungunya, malaria, which unfortunately has been very prevalent in the city, especially in our city in the recent past. The presence of congested living areas and slums, again, which are common in cities, add to the healthcare woes. Hence, a well planned city is important for the health of all its citizens, and we need to work in that direction.
Absolutely, Dr. Ballal. Now, unfortunately, city planning has largely been left to the realm of city planners, if at all, or to engineers for the most part. And although the problems are fairly complex and require sort of this multidisciplinary approach in terms of solutioning and also thinking about it, we have a very limited view of, who designs, how we design and plan our cities. So, as someone who works closely with government agencies on health aspects, do you think there's scope to bring in the expertise of the medical fraternity to improve city planning, and how would we do that?
You are absolutely right. I think without citizen participation, no city can be an ideal city. And we need planners, administrators, and the citizens to proactively look at what is best for their city. And there is a huge role for a partnership between the city administrators and the medical fraternity in planning the healthcare of the city. Preventive public health measures, awareness, early detection of disease, and pandemic preparedness, as we saw earlier, are things that the medical fraternity and the planners should do together. Use of technology would amplify these measures, and these things worked very well during COVID. That's probably the best participation we had between the citizens and the administrators, and everyone worked together. And fortunately for us, we were able to overcome COVID much better than many other cities and many other countries.
No, absolutely. And COVID was that one type of crisis. And now we have another type of crisis on our hands, which is sort of looming large and defining a lot of what's happening in cities, which is the climate crisis. And adding to your typical stressors, of living in urban areas like long commutes, pollution, sedentary lifestyle, cities are also now faced with the climate crisis. Even in Bangalore, we had a particularly harsh summer this year, and we've been experiencing heat waves, floods, water scarcity more so now than ever, and sometimes all together. This happened in city after city. It happened in Bangalore. It happened in Delhi. It happened in many places. So, what impacts do you see these climate shocks and stressors having on people, especially the most vulnerable groups?
Now, I believe climate change is for real. It's not that only the activists talk about it. It is for real, and it is very visible all over the planet. You see snow in Dubai, which you have never seen before, melting of the icebergs in Antarctica, flooding, drought, and landslides have become the norm. And unfortunately, the brunt of this is borne by the less privileged in the society. A typical example is the recent landslide in Wayanad, where most of the deaths happen among the poor plantation workers who had nowhere to go when the landslides happened. So, unless we learn the art of balancing development with preservation of the ecosystem, we are in for a major catastrophe. And only God can save us, probably, at that time.
So then, as a physician, I'm sure you believe that prevention is better than cure. So, what do you think we can do to make our cities and people more resilient to shocks and stressors which are, driven by climate change?
So, better short term and long term urban planning, management of water resources, attention to greenery parks where people can work out, walk, and also be physically fit, eco friendly development, better management of sewage and stormwater drains, traffic management, which is the bane of urban life these days, conservation of resources. We have too much of everything. We have too much of rains, too much of heat, too much of water scarcity, but we never have enough of everything. So that's the problem. We move from floods to a drought and back to floods. So I think we have to balance what we have. I think we should learn the art of harvesting water when we have it in excess and using it when we need it. Public health measures to prevent vector borne diseases and waterborne diseases is absolutely important. It's really unfortunate that all hospitals in Bangalore now are full with viral illnesses and gastroenteritis. Almost every hospital. I mean, this is totally an avoidable illness. I mean, we can take care of the mosquitoes, we can take care of clean drinking water, we should manage our sewage better. And these things really should not happen. And unfortunately, it is happening. And these are issues that all of us need to address urgently.
No, I really like that you're saying that we really need to take care of and manage our resources. It's not that we don't have the resources, it's just that it's poorly managed. And you're talking about water, you're talking about greenery and spaces. So, from where you sit, what would you say is the most urgent health need that city officials can address to help the residents, of cities cope with or prepare for climate hazards?
A robust public health measures to prevent communicable diseases. Primary health care, vaccination, maternal and child care are our urgent needs. Developing and upgrading public health care facilities, PPP models for tertiary healthcare are issues that we can address and actually get it done with the kind of resources we have. Mental health issues is another thing that we should not ignore. We see it on the rise, especially following the COVID pandemic. For various reasons, we see a huge increase in the mental health issues, and it needs more attention than what it is getting. Most importantly to me, a viable universal health insurance to prevent out of pocket expenses by the common man is the need of the hour. No one can afford care in a private setup these days. I mean, even in the US or the UK, if you had to pay for your healthcare from your pocket, you would be bankrupt. Unfortunately, in India, that's happening to a large extent. We are better than what it was when I first came to India, but we still have a long way to go.
Right. No, that's true, Dr. Ballal, and you've been sort of helping patients for about 45 years, and you've seen healthcare evolve in good ways, but then also these cost implications, the other kind of new health challenges, especially mental health challenges, which are now emerging alongside because of COVID, but other reasons as well, and living in urban environments probably. So, given your vantage point and worldview, how would you describe the elements of a healthy city, and whose job do you think it is to create one?
I think we have already discussed the various ingredients that make a city healthy. And to summarize that, I would say eco friendly, eco responsible development. Everyone wants development, but not at the cost of destroying our environment and causing climate change. Good infrastructure, absolutely necessary. Traffic management, anyone who lives in Bangalore, I think that would be very high up on your priority. Spending hours of gasoline on the road and that to pothole filled road is certainly not a pleasure of living in Bangalore. Public transportation would certainly help, and that would also reduce pollution. Better connectivity, healthcare for all, both insurance and facilities to offer healthcare, preventive primary and public healthcare measures, and PPP models where needed. And most importantly, inculcate civic sense in our citizens. Everyone keeps their surroundings clean, but you move out a little bit, you spit, you throw your garbage. I mean, that really bothers me. You have no care for your fellow citizens or anything else that does not belong to you. I think this is something that we have to inculcate in our younger generation. Maybe too late to sort of change the older generation, but at least the younger generation, we should inculcate civic sense in them. And to me, a corruption free society is a dream that all of us as citizens need to work on. I
No,
think the utopia can be real only if all of us in the society and administration work together.
no, absolutely. So it is not just, pay your taxes and somebody will take care of everything. It is all of our collective responsibility and most of all civic duty and, doing the basic sort of courtesies of not littering your surroundings, keeping everything clean for yourselves and for others. But good point that, all of that also starts with each of us. So I think all of us have a role in sort of city building and maintaining good and clean cities. So, you know, good to hear that it's a bunch of different stakeholders that we need on board. So, lastly, Dr. Ballal, how can we make a compelling case for building healthy cities and neighborhoods, especially a political case, because typically what is responded to, also your point on, corruption a little bit, but what is responded to is, how can we, exploit resources to get the maximum economic advantage. Our economic models are set up in a certain way where that is the thinking. How do we build a compelling case for, healthy cities and neighborhoods?
Yeah. Building healthy cities and neighborhoods is not just a wish anymore, but a dire need without which all of us will perish at some point. Unfortunately, public memory is very short. We will soon forget COVID, dengue, gastroenteritis, the floods, the water scarcity, and the landslides, and it will be business as usual. Our duty to our administrators and politicians is to keep this memory alive to prevent future disasters. What we do now is more of a knee jerk reaction. There is a flooding, you patch up something. There is drought, you patch up something else. But there is no long term planning, and we have to keep this memory alive with our politicians and the administrative class so that this work is not a one time thing, but it's an ongoing procedure.
No, absolutely, Dr. Ballal. You said it just right. It's an ongoing procedure. This is work to be done, and it's work for all of us to be done. With that, thank you very much, Dr. Ballal, for your work on public health and service that you've been doing much, selflessly and with all the kindness over so many years. And also for your willingness to talk about cities and how do we make our cities and living environments better. Thank you very much. I enjoyed our conversation and I wish you all the best in all your endeavors, Dr. Ballal.
Thank you, Jaya. It's always been a pleasure interacting with you. And hopefully, at least some of the points of what we discussed become a reality. We would have taken our first step in making our city the Shangri-La of the world. Thank you.
Thank you very much.
Bye.